Hello, everyone, and thank you for joining us. This is the first Robson Forensic webinar of 2025. Before we kick it off, a few housekeeping items. We ask that you please refrain from recording any audio or video or taking screenshots during today's webinar. This presentation and the corresponding slides are copyrighted by Robson Forensic and may not be recorded, copied, distributed, or otherwise used without authorization. Today's presentation is on animal abuse, cruelty, and neglect investigations. Two veterinarians from our animal science group, Dr. Kenyon Conklin and Dr. McGee Leonard, will be presenting today, and I will hand it off to them.
Hello, my name is McGee Leonard. I'm a veterinarian based out in California. I've been practicing emergency and critical care medicine for 15 years and have been a boarded specialist in critical care for almost 10 of those years. So any kind of specialty care, any kind of all the disciplines in medicine at the higher levels and specialist levels fall solidly in my wheelhouse.
Hi there, I'm Kenyon Conklin. I am our other Robson Forensic veterinarian. I have about a little over 20 years of experience in a little bit of everything from general practice to emergency medicine. I've done large animal and equine work. Also have worked for the Department of Defense as an Army veterinarian, where I gained experience in Department of Defense research, and also became a foreign animal disease diagnostician at Plum Island. So we are going to go ahead and kick off the rest of our webinar.
So the casework that we handle with Robson is essentially anything that involves animals. I do a lot of investigations into claims of veterinary malpractice or negligence. For any casework, we will do investigations on behalf of plaintiffs or defense work. There are a number of different types of injuries that may be associated with animals, be it somebody falling off of a horse or getting bitten by a dog. Issues around animal containment or fencing of large animals as appropriate containment or the lack thereof may be a contributing factor to injuries, injuries to animals, injuries to people, also the outbreaks of some kinds of infectious diseases. And in addition to veterinary clinics and such, we are also qualified to investigate any other animal-related facility, be it a boarding facility, training places, grooming businesses. So we do a lot of different kind of things, but today we are here to talk about animal cruelty investigations.
Sure. So getting into the meat of why we're here today, these are investigations that Dr. Leonard and I are seeing inquiries on more and more frequently. And we wanted to give you a little bit of a background on the basics of these investigations and what we look for. So they are obviously technically and emotionally challenging for all stakeholders, ourselves included. We will investigate these matters on behalf of the plaintiff or prosecution, depending on the matter, or defense. Our experts at Robson, not just in veterinary medicine, but in all of our cases, we do have final discretion in accepting cases. If we feel after a scoping call that we cannot assist in the matter, we will certainly let you know that. However, there are times that we go through a scoping call, your client decides that they want to retain us, and after our full scientific investigation and evaluation of the facts of the matter, our opinions may not always be favorable. However, we have received very strong feedback from our clients letting us know that our investigations, even if they aren't completely favorable or aren't favorable at all, allows them to move forward with their client knowing that they did everything that was possible for their client.
So when we start these investigations, we start with the most basic questions about how the animals involved are cared for. Do they have access to nutritionally balanced and appropriate foods? Do they have access to clean water? Do they have enough space that the areas where they may relieve themselves is not contaminating the same area where they may be getting their food and their water? Do they have enough space? Can they move around and perform their normal behaviors? Is the area where they're kept, is it kept clean and sanitary? Grooming is also something that comes up as part of these basics. A good example of this would be something like a little long-haired dog, like a Shih Tzu or Maltese type dog. They are prone to growing very long hair coats, and if those are not maintained, they can become matted. They can fester skin diseases underneath the fur. Nails can become overgrown. Eyes can become infected. And so we're always going to start with the most basic requirements of whatever animals are involved.
As we look further into the investigation, there are additional matters that we're going to assist you into looking into. The first is what we call allowance for species-specific behaviors. And what that means is just different animals have different needs for interactions with humans and interactions with other animals, whether it's within or without their own species. Numbers of animals can be very critical to our investigations. We're going to talk a little bit later about hoarding. This is a little bit different. Number of animals just being reasonable for the environment and the caretaker's ability. The last thing that we look at in this additional facets of investigation initially before we help to prepare you a gap analysis to see what other materials would be great if you can get them for us is veterinary care. Basics like the preventive care that we're all used to hearing about for dogs and cats, things like vaccinations, flea and tick prevention, heartworm prevention, those sorts of basics. Also, what was their treatment for an acute illness or injury, and also treatment of chronic illness. So making sure that animals are receiving not just a treatment for a illness or injury that happens right away, but also chronic things such as senior animals. Are they receiving the appropriate care to make sure that they can move without severe pain from arthritis, for example?
The framework of these investigations is going to be very similar, or at least start in a similar place, regardless of what types of animals are involved. So when veterinarians use the phrase exotic animal, that typically will mean anything that is not not the most common species that are kept as pets. So essentially anything that's not a cat or a dog or a horse. So that may include things like small mammals, like rabbits, hamsters, things like that. May include species such as birds or different kinds of reptiles, or may include animals that you would be more likely to see at a zoo, like big cats, alligators, things like that. And species-specific behavior allowance really plays in heavily with these species as they have very particular needs. Reptiles are a great example of this. Some reptiles come from arid desert environments, some come from humid tropical environments. And that's really going to affect what these animals need in captivity to be properly cared for. And so when we're dealing with exotic animals, other things we might look into are, is the caretaker of the animal, are they properly educated on the natural history and the biologic needs of the particular species? And likewise, not every veterinarian is going to be dealing with some of these more rare animals. And so does the caretaker have access to appropriate veterinary care that has the proper experience and training to deal with whatever species we're looking at?
All right, and similarly, large animals. And when we talk about large animals, we're including pretty much everything from horses, cows. When we say small ruminants, we mean things like goats and sheep. Other livestock we can even include in this. Sometimes we now have a lot of backyard poultry farmers that can either cross over into what we would consider this large animal or livestock realm versus exotic animals. So the big thing is understanding what is normal for how these animals should be fed and cared for and cleaned up after. And we get a lot of inquiries that deal with the fact that Farming and large animal husbandry, meaning the care of these animals, can be really unfamiliar to a lot of folks, especially when they're starting to move into more rural areas, and we're seeing these areas undergoing rapid housing development. So you're getting this friction point between farming areas and folks who are not familiar with it, and making sure that we all understand what normal is for the purposes of an animal cruelty investigation. However, regardless of the animal, you've probably picked up on a theme here. The basics are still the same. Adequate and appropriate nutrition for the specific animal, keeping them in a safe and hygienic environment, whatever that looks like for that particular animal, and adequate veterinary care is essential.
Animal hoarding is a particular category of animal cruelty. It is the most common type of animal abuse investigated in the United States. And essentially, hoarding refers to an individual or a household or a facility that has far more animals than they can properly care for. These animals in hoarding situations are often stacked on top of each other in cages or somehow packed into just too small of a space. They are usually not able to move around normally. Hoarding environments can become very unsanitary very quickly, with fecal and urine matter and hair and parasites and all sorts of gross things. Some hoarding situations have kind beginnings, have started with good intentions. It's not I've seen it many times in my clinical practice that an individual or a group of individuals starts off as a rescue group, meaning to help animals that are not getting help elsewhere, and then things sort of spiral out of control and things outgrow their margins and they can't be properly cared for. Aside from the typical sanitary issues and crowding issues, there is a certain number, you pass a certain threshold of pets, and whoever's in charge of them may just not have enough time in a day to see all of them and to notice when problems start. They may also not be able to financially care for so many pets, even if they would like to. Animal hoarding in its more extreme cases is also concurrently seen with other severe mental health challenges to people, and is often associated with other maladaptive, injurious, and sometimes criminal behaviors. So they're intense to go through, and they can lead to a lot of different places beyond just the conditions of the animals.
So why do you specifically need a veterinarian for these types of investigations? Because you hear about all sorts of different animal professionals, everything from behaviorists to trainers to your animal control officers. It's really important to remember that a veterinarian is truly the only professional that is qualified to opine based on our education, training, and experience to see what all facets of an animal's health, veterinary care, training, behavior, and containment are, as opposed to what we would expect for a reasonable and prudent person or group. So we are uniquely qualified to review and opine on some things that, unless you do a lot of these cases, are going to be really unfamiliar to you. Things like necropsy reports and necropsy findings, and a necropsy is basically an animal autopsy. Also, there are a lot of things that we can distill down for you very quickly from veterinary records that would be otherwise kind of dense material to go through, and also to look and see, the thoroughness of animal control investigations. Was a necropsy appropriately done? Was animal evidence appropriately preserved? So those are all things that a veterinarian is typically the best and most cost-effective expert that you can retain to assist you on these matters.
And we at Robson have a whole team of experts in all sorts of different fields. Animal cruelty investigations may lead down other roads, as I said, beyond just the conditions of the animals. There are what hoarding situations and things can be associated with disease outbreaks, There can be other types of human on human violence in some of these situations. And you know, people accused of animal cruelty, you know, that may lead us down to other medical or psychiatric or, you know, neurologic issues. And so in the course of our investigations, if we discover that maybe there's another avenue that the case needs to go down, we can certainly point you in the right direction of other experts in the firm that can do those investigations as well.
Okay, so as we wrap up, before we get to your questions, we each wanted to give you a case example. These cases have obviously been sterilized to not give any identifying information, but these are some common fact patterns that each of us have seen. So I've received several cases with this kind of similar backstory. Farmers or other large animal practitioners or fanciers in rapidly developing areas being charged with animal cruelty or animal neglect. So in this scenario, animal control received multiple complaints about thin animals and no available food or water. The backstory from my client was that the farmer who had some cows and some horses on his property was a senior citizen who had recently had some orthopedic surgery and was having a tough time getting around. However, he was being assisted once a day by his daughter's husband to go out and feed the animals. The only problem is the son-in-law is trying to get out there in between working his day job. So he's able to get out there with the senior farmer once a day instead of the 2 to 3 times a day that the folks living around there were used to seeing this farmer out there. So the combination of not seeing him out there as frequently and seeing some animals who appeared thin to these lay people resulted in animal control coming out. During our investigation, we were able to determine that the amount of food and water that was being provided to the animals was actually more than adequate, even though it was given once a day. They still had food and water in front of them, and the amount was perfectly reasonable, and that the body condition of the livestock was actually normal for the ages and breeds of the animals involved during the time of the year. So if you don't have folks on your staff who are well acquainted with what say a cow should look like after it's done weaning a baby, you need to have those people on your team, because otherwise an animal who may be perfectly normal for that phase of its reproduction could look thin or unkempt or uncared for, whereas it may be a variation of normal.
Again, you know, a common fact pattern that I see both in my Robson work as well as in my clinical practice would be a dog who was brought into an emergency clinic for limping. The owner reports that the dog had fallen off the bed. And in the process of being assessed by the veterinarian, they find that the dog has a broken leg. And the nature of the fracture on the x-rays that are taken is concerning to the veterinarian. It does take quite a bit of force to fracture the long bones in the leg. And an otherwise healthy dog falling off of a bed should not sustain an injury that severe. The veterinarian is concerned that there may be animal abuse in the home, and so contacts animal control to file a report. However, this dog is subsequently transferred to a surgeon to have the broken bone repaired. And in that process, they discover that the bone is actually abnormal, and the dog is ultimately diagnosed with an early stage of bone cancer. And bone cancer makes bones more brittle and fragile, and in that case, falling off a bed would be enough to break a diseased bone. And so there are plenty of times that I see concerns about animal abuse when actually there's a completely reasonable medical cause for whatever the injury is.
Okay, Anne has been monitoring for us as we've been chatting, so we'll turn it back over to you.
Thank you, Dr. Leonard and Dr. Conklin, for all that info. Everyone, if you have questions, please submit them via the Q&A button at the bottom of your Zoom window. Alternately, you can email us at inquiries@robsonforensic.com, especially if your question is related to a case that you have, because we're not going to answer those live. But to start off, so we're talking about animal abuse, cruelty, and neglect. How do you differentiate between those terms?
Sure. So neglect can be pretty straightforward from the sense of neglect is an animal that is not getting what it should. However, it gets a little bit tricky, and this is where, you know, we can assist our attorney clients in looking at the statutes where you're at, because as veterinarians, you know, we do have to help law enforcement and clients look at this terminology and interpret it, but it can be very different from jurisdiction to jurisdiction what is considered abuse versus cruelty. So it's very nuanced, and it really depends from area to area.
It's fair, and that makes sense. This next question, I will caveat by saying, well, actually, no, I'll ask the question first. Do you work in cases involving animal attack and the argument of self-defense, or cases that focus on whether the euthanization of the animal was necessary and or done in the least cruel manner? Before we answer, I'll say we did also have a webinar late last, actually it was 2023, with Dr. Conklin on dog bite cases. So if you go to our website, or I'll drop the link to that in the chat, you can watch the whole video of that presentation, but I will give the experts a chance to answer here as well.
Certainly, you know, certainly I've done a fair bit of work, and I know Dr. Conklin has as well, with situations where an injury is claimed to be due to a dog bite, and the other side is saying that the injury came from some other non-dog bite cause. We are certainly able to opine on, you know, the injury patterns expected with dog bites and things like that. What was the other part of the question? I'm sorry.
The other part of the question was cases involving animal attack and the argument of self-defense.
Yeah, I've actually had several involving that fact pattern recently. So yes.
That was an easy one. The answer is yes. That looks like all we have for right now.
Was there a question about euthanasia in that as well?
Yes, whether this was, yeah, this was like a triple barrel question. So many questions.
Yes, I have definitely had cases where we were investigating the euthanasia of an animal, whether it was indicated that the animal needed to be euthanized, and also methods of euthanasia. I have a lot of experience with hospice care and euthanasia procedures. Have been to several conferences on the matter, and so yes, we can absolutely opine on all of those sort of euthanasia, end of life, hospice care kinds of issues for sure.
Definitely. All right. Well, thank you again, experts. This has been extremely informative. If anyone has questions that come up after the fact, all of our contact info is on the screen. We are not hard people to get a hold of, so just reach out to us and we will get back to you quickly. We hope that we see you on our next webinar.